Are we ready?
Well, we're ready. We're rolling. We're rolling. Are you ready?
2,
I'm ready.
1.
3, 2, 1, go. I feel like we should clap. Should we clap?
No,
should we do what?
Slow clap? No. Okay.
1, 2, 3, go.
Rob. Hey, friend.
Hey, Jess. How you doing, friend?
I'm doing great. You know, we've been doing this like can see you. Everybody can see us. So I'm a little
I know.
Trying to get my lighting right because I definitely want to be in front of this window and at the same time recognize that could be a problem. So hi, everybody. I hope you can see me.
The fun world
I might go
of
in
video.
and out of my poor camera trying to keep up. How are you?
I'm good. I'm good. Summer is very much in full swing. We're deep into summer now, right? Especially by the time this episode airs. So I hope I'm still alive at that point. This might be, or if not, my kids have literally run me ragged.
Yeah. Well, and you have a puppy now.
I have actually a fun question for you on speaking of summer. Yeah. Do you know that little like the popsicles that you buy that all come in a line of different colors? Yeah. You know what I'm talking about? They're like super cheap at the grocery store.
Ones, the like ice, thin icy.
What do you call those? Icy. This is like a hotly debated topic amongst some people in my space here.
Ices.
Ices? Just one? That's it? Ices? Is that your word for it?
Ices, yeah.
Wow, that's a new one. I haven't actually even heard that.
What do people call it? Oh, by the way, everybody, I have to remind our listeners that I had Invisalign in, so I talk with a lisp. Somehow I feel like I'm so insecure about it that the world needs to know.
You've already mentioned that. That was last episode.
I know, and nobody cared. But what if somebody just is tuning in? They'll be like,
what if someone's a new listener and they're like, what's up with Jess's voice?
And it's okay because I think my lisp is cute. But I also wanted to point out that my S's are going to be a little, because I have to keep them in, can only take them out 2 hours a day. So these podcasts.
We should totally get an Invisalign sponsorship out of this.
Absolutely.
We're giving them some serious, that and Ices. We're just begging. Right now what we're doing is we're just kind of teasing out, seeing who's going to bite. We're going fishing. To answer the original question, I thought it was between 2 options. You introduced a third one, and I think we're going to need our guest to come in here soon to help maybe split the difference. I thought it was between Freezy Pops and Icy Pops. Like you're just sticking with Icy. I called them Freezy Pops.
Yeah.
When I was growing up.
Yeah. No.
Is that not? No, you just called them Ices.
Just Ices. What do you call them, Joy? Oh wait, Joy's on. We're not supposed to say that she's on. What to do?
we're not. You can. We'll save that. Save that, Joy. Save it.
Okay, Joy.
She has an opinion. Don't tell us yet.
We'll circle back.
We're gonna come back and ask you.
Yeah. Okay. We're slow tech. I forget the process here. Okay. Anyways, all right. So you're a Freezy Pop. I'm an Icy Pop, apparently. But
you're Icy. You're just Icy, right?
Ices.
Don't feel like you have to change your answer for
me.
I'm
not, but I think I'm more on the side of. I'm not Freezy Pop, but that's what they're called. Isn't that the brand? It's called Freezy.
I don't know.
I don't know.
I guess I'm just so excited by how cheap they are at the grocery store. I don't actually look at the name. I'm just like, how is it that something is just $2 and I get like 400 of them? That's amazing.
It's called
such a good deal. Everybody loves finally getting it.
It's so cheap. It's just sugar water.
Yes, you're right. It's not a complicated recipe.
Frozen
that's why.
Kool-Aid is what it is. Yeah.
So we'll throw it out on the now that we're social media, we're video, right? We got our own Twitter handle, Instagram handle, the podcast Just, right? Yeah. Here's a shameless plug, right? Follow at the podcast Just, and maybe we'll throw out a question or a poll to our audience. What is the official name? We'll need to put a picture out so we don't bias people, right? A picture of this item.
Okay, yeah.
And then just say, here are the options. What do you call this?
Yeah.
And we'll just see.
Yeah,
maybe we put a friendly wager.
Out of the freezer. That's exactly what it is for me. I just had to think about it. Like, is that the word I use? It's definitely the word icy. Okay.
I love this.
Confirm my bias.
This confirms to me how important this warm up conversation is to our podcast. People need this. People need the truth.
Do they?
When it comes to what this dessert item is called, and I'm really glad.
I feel like we don't need to check in anymore. Like, this was the most important thing we've established today.
The most important thing about each other is what we call this dessert that we keep in our freezers. Yes.
Yeah.
That's it.
Okay. Well,
mission accomplished.
I think it is it because I'm super excited about asking Joy the questions. I feel like I need to get through her bio so I can get to her answer. So are we okay if I don't?
It's not the most important thing about her, but we do need this to be incorporated into her introduction. Yeah,
All right.
Really so.
So Joy, we know you're here. We can see you. I'm not going to ask you just yet. I want to introduce you to our audience, and then we'll start with your answer so that we can kind of use it as our leverage into the first question. I'm excited, though. How are you, Joy?
Welcome, Joy. Okay. We're so glad to have you. Can you hear us okay?
I can hear you. Can y'all hear me?
Yes.
Oh, we can. Loud and clear.
Outside my window, by the way, waving at me while I'm recording this. So that's why I'm doing this. I sit in a space that feels like an aquarium, and so people were waving. My apologies. Joy, I'm so glad to see you, friend.
So happy to be here.
So I get the opportunity and pleasure to introduce you. And I'm glad that I do because, Joy and I we found our way to one another very randomly through Leadership Triangle and Christine Sloan about a year ago, I guess, when she made an introduction. And I got a chance to meet Joy and learn about her work and was just so impressed with all the things that she's doing for the community and for moms and families. And I just as a mom, having been through we all are, we're all parents, but having gone through what it really, the work and the stress and the pressure of being a new mom, what that really looks like, getting prepared for parenthood is a lot. And so in some of our communities, it's monumental. And so the work that you're doing, Joy, is so critical, and I'm just honored to know you. So I'm glad that you're on our podcast today and that we get to introduce you to the world. So I'm going to formally do this by going through your bio. So Joy Spencer, who you see here on the screen, I hope for all of you who aren't, go to YouTube so you can see Joy and her beautiful face and her killer earrings today. Joy is the Executive Director of Equity Before Birth, a Black maternal health charity organization working to eliminate disparities and improve maternal health outcomes by providing paid leave opportunities, and increased access to prenatal support services. All of that is so important. Joy is a proud mama of an almost 3-year-old and lifelong advocate committed to achieving equity and authentic community engagement. Her baby's getting ready to turn 3 very soon, so happy birthday to her. Joy is also on the policy side and a sense of advocate. She testified before Congress on the importance of childcare and paid leave, so we're grateful for your voice on that topic. And she launched as executive director, has made some huge waves in this work. Since 2020, in the pandemic, she gained over 25 community and direct service partners, raised over $250,000, received $30,000 in grants, and assisted 40 families with an average of $1,000 each in direct assistance. And I'm telling you that money that goes a long way. $1,000 is huge in that space. So, and then also distributed approximately $20,000 to Black families and birth workers. We don't want to forget that. So, Joy, you are doing incredible work, yeoman's work, I like to say. Thank you so much for just the investment that you make and just being a great mama. Welcome to the Just podcast.
Yay. Thank you for having me. Thank you for that introduction. I'm so excited to be here and such a huge, huge fan of both of you and the Just podcast.
Yay.
Well,
go ahead, Rob.
We're excited. I think, can I ask you now?
You have to do it because it's your question.
You've been listening to our personal check-in time. Do you have an opinion on what these desserts are called? These icy pops, freezy pops, ices. What's your vote? Is there a fourth option, or are you on one of our teams?
Yeah, I do. And I was gonna say we call them popsicles. That is our popsicle. That's the only popsicle option that we knew. We couldn't get the name brand or the fruit bars or anything fancy, and so that was our popsicle. We just call them popsicles. I have heard them called freeze pops before. But when little kids in my neighborhood ask for popsicles, that's what we had in mind.
Mm-hmm. Wow. I'm having a growing suspicion that every single person in the world has a different name for this. Because, what are the odds? All three of us called it something different. Yeah. How many possibilities are there?
I don't think there's many more, but maybe okay. There are, because we know. We are currently at 4. You gave us 2, and then Joy and I gave us.
You didn't even humor me Like I went to the extreme and said every person in the world, and you didn't even say like, oh, maybe there's 10. You said no, there's probably not another one.
Probably not.
Well, we're excited to have you on.
I gotta keep us honest.
Oh.
Well, Joy, again, thank you so much for joining us. Why don't we just get started from the, let's just set this stage here. Talk to us about equity before birth. Help us understand, help our listeners understand what the disparity is. Why are you doing this work, and how are you helping to address it? So, let's just dig into your work.
All right. So, a little bit about why. So, the United States has the largest healthcare budget in the world. We have the most money pumping through our healthcare system. But compared to similarly developed countries, we actually have the worst maternal and infant health outcomes in the world. I think we rank literally 33 or 34 out of 35 industrialized developed countries when it comes to birth outcomes and maternal health outcomes. And then when you disaggregate that data and you zone in on race and ethnicity, you see Black women and Black birthing people faring far worse, where our infants are dying at twice the rate of white infants before celebrating first birthdays, and our moms are dying at 3 to 4 times the rate to preventable pregnancy-related complications. And that is on average. When you control for career, education, income, it gets worse, and we see disparities up to 12 times the death rate and up to 12 times the poor health outcomes. And so we are in what I call a maternal health crisis. We have the resources. In fact, over 60% of pregnancy-related deaths are preventable. So this is totally a solvable problem. We just need to invest and put the resources and support where it needs to be in order to resolve the problem. And it's morbid to talk about mortality and death, but that's where we are. But even if we go beyond that, for every pregnancy-related death, there are 70 near misses. So 70 additional birthing people who either experienced a traumatic experience or a near-death experience when it came to them trying to have a baby. So we are in crisis, and we need to do better, and we can do better. And so there are several organizations and efforts that help to uplift the health of families and infants and children. Equity Before Birth is a fairly new charity organization and taking a fairly new approach. What we are doing is we are saying we know there's a link between financial security and health outcomes. And so we are really fusing economic justice with birth justice to influence those birth outcomes by way of promoting financial security. And so we're kind of taking a nuanced approach to it, but we are leaning heavily on research that says, for example, for every $1 increase of wages, the infant mortality rate in that area decreases by up to 4% for that year. And for example, when you have paid leave, the rate of postpartum depression and maternal depression drastically decreases because you are not stressed about keeping a roof over your head and keeping your utilities on while you're healing from a birth event or bonding with your baby or trying to figure out how to feed your baby and things of that nature.
Yeah, I remember hearing that statistic around the minimum wage when I was working, or I was serving on the board of Prevent Child Abuse North Carolina that focuses on prevention and abuse, obviously, and neglect. And I could not believe, I just couldn't believe it. Just the economic levers that you could pull that could change families across the state of North Carolina. And if we're going to make a business proposition, it saves the state of North Carolina, I think, billions of dollars. I can't remember, you probably know this, Joy, but the amount on the bottom line to make one lever pull over on the right changes the bottom line on the left favorably, if we're talking about economics. Why we don't do that is beyond me. I just cannot wrap my mind around the politics to not make one decision in order to impact not just lives, but then if you want to make that business imperative, it makes sense, and we can shift dollars in different spaces and different places across the state. But instead, we don't do it. And I would love to. That's not a question in here, but it's really something that I cannot sort that out. And really glad that you brought it up, because we are in a crisis and it feels like the solutions are right in front of us.
Mm-hmm. Yeah, those statistics are staggering. And I mean, just when you zoom out, I guess you're nodding along and it makes sense. You hear, oh, the U.S. is at the top of a list, and you're like, oh yeah, okay, that's not shocking. We're the most well-funded healthcare system in the world. You're like, yeah, okay, that makes sense. But then when you talk about the fact that we're 34th out of 35th of all developing countries, right? And I don't know if you mentioned this earlier, Joe. I don't think you did, but the maternal death rate, right? Pregnancy-related death in the U.S. has doubled since 1987. That was a stat that from your website that really jumped out to me. It really feels so backwards, right? We think about our society as, hey, we're moving forward, especially when it comes to technology and health, right? These things should be less and less the case over time. But somehow, with all this money that we have in our country, this is something that's actually getting much, much worse. Not even just staying the same, which would be sad. So tell us, Joy, you mentioned this. There are so many organizations nationally and even locally that work with mothers, work with families with young children. But Equity Before Birth, I think you guys do a really wonderful job of naming your distinctives. You even have a section on your website that says, why another nonprofit? You just meet it head on. I love that. I love that because we're all here in kind of the Durham community. Everybody is thinking it. That's a question that pops up all the time is, hey, why do you need to exist? And you just really lean into that. Say, here's how we're different. Here's how we're leaning in to fill some gaps. Kind of tell us what sets you apart that no one else is really doing the way that you guys are doing in our community.
Yeah, so a few things that set us apart. One is our commitment to autonomy and treating families with dignity. So giving and empowering them with the resources that they need to get what's best for their family and their baby. So when your employer doesn't offer you paid leave, we provide supplemental income up to $2,000 in a month to help create that cushion and not push you further into a financial bind just because you decided to move, transition your family and expand your family. And so what that does is we're not, making people give us receipts, and we're not making people say, hey, this is what you have to spend money on, but it allows folks to continue with their, routine and continue to meet their family goals. Another thing we do that's unprecedented is giving direct financial assistance for essential baby needs. You don't have to take a class and send in your pay stub and have us verify your hours with your supervisor. If you say, hey, they're not going to let me come home from the hospital without a car seat, we're going to give you the funds you need to get that car seat. And if you want that car seat to be turquoise with purple polka dots, it can be turquoise with purple polka dots. It doesn't have to be a hand-me-down stained car seat just because there may be a financial hardship that you're going through at this time. And we cut the bureaucracy with that. So we're not a default kind of mini social services. We really and truly speak personally with each family, figure out what their needs are, and do a cost analysis based on that to try to cover those needs and meet the baby essentials. And then lastly, we are directly covering the cost of perinatal support services. So you come up with your birth plan. What would be your ideal way to transition into parenthood? Maybe you want a doula and you want breastfeeding support and you want your placenta encapsulated and you want a nutritionist that will help you stay healthy or get back on track after you have the baby. You can have the best job in the world, the most supportive family and spouse, and that $2,000 doula and that $150 an hour for a nutritionist and that $350 placenta encapsulation fee can still be outside of your budget. What we know is that having continuous support, whether it comes from partner, spouse, community, doula, increases birth experience and birth outcomes by up to a third, 33 to 35%. Just having someone there to support you can drastically improve your health outcome. It promotes full-term labor and delivery. It reduces chances of C-section, and it overall improves your vital signs in your actual labor and delivery. And so if the only thing stopping you from getting that optimal care team, that optimal experience is finances, we want to cover that cost. We want to cover the cost of that doula for you, cover the cost of that lactation consultant, that therapist, so on and so forth. And what makes that unique is that we are intentionally partnering with BIPOC, Black and Brown birth workers and birth educators to get those services out to families. So when we pay birth workers, Black and Brown educators and birth workers market rate, not only are we increasing access to those services for Black and Brown families, we're connecting them to a provider that looks like them, and we are sustaining Black and Brown birth work, which was systemically eradicated. Our means to deliver our own babies and take care of our own babies was systemically eradicated with the birth of the obstetrics field, right? So a white man came and said, oh, actually, we're going to put these things in a book, and if you can't check these things off in a book, you can't practice. And so we are kind of like revitalizing Black and Brown birth work while simultaneously supporting families and building a comprehensive ecosystem to support families that are in the perinatal stage. Because what that's doing is we cover the cost for services, but we don't provide services. So what we're doing is we are seeking organizations and businesses in the community who are already serving our families. And we're saying, look, can we add these families to your caseload and cover the cost of that and kind of amplify and sustain your work simultaneously?
You get that, Rob? All of that?
I'm just taking it all in. It's incredible. It's incredible. And I think, Joy, you cover that so seamlessly for our listeners. I think it's really helpful the way you paint that picture of the ways you're stepping in, but also the ways you're not stepping in because things already exist that you're amplifying, which is such a beautiful combination. Like, people aren't doing this over here, so say, hey, my hand's up, we'll go do it. People who are already doing this, we're not going to replicate that. What a beautiful combination that I think is really rare, Jess. You know, you look around the nonprofit sector locally and nationally, usually people, you know, end up not filling gaps, right, or being redundant, and you're really doing, you know, the best of both of those worlds, Joy. So I applaud you.
Yeah, it's well said.
Thank you.
Well, so now I want to know, and I'm sure our listeners want to know this too. Why? You know, you're doing some really incredible work. Grateful that you're doing it, but you know, what has driven you into this space, right? This is a challenging role, important and critical work. What's your story? What motivates you?
Yeah, so I grew up with one of the best moms in the world, and we grew up in rural Eastern North Carolina and just didn't have a lot of resources. My mom started a nonprofit over 30 years ago to advocate for some of the needs that her children had. This was at a time where trauma was not really understood, trauma-informed care, mental health, the importance that children had mental health as well, that we needed to take care of, social emotional health. So long story short, Mom really ushered in the Nothing About Us Without Us movement, and having lived experience and having families at the table, and especially in terms of your mental and physical care. And so I was kind of born into advocacy work. I am dating myself, but used to have a toy typewriter thinking I was taking minutes at like different, you know, board meetings and community meetings and things of that nature. So I've always had a special place in my heart of empowering, uplifting families, uplifting family voice, uplifting moms. In fact, I was told, my mom was like, when I was in like kindergarten, they say, what do you want to be when you grow up? And I say, a mom. That's just where my heart has always been. So fast forward, I've just always been an advocate for, in line with my experience for Black women, for moms, for families, especially families who may be low on wealth or low on resources. But it really hit home. So I do this night, day in my sleep. It just really hit home when I got pregnant and went through my own journey with my kid. I have experienced a lot of systems. I was unemployed. I did not have paid leave. I did not have health insurance. I did not have family close by. I did not have a partner. So I just needed to lean in on community for support and resources. And it was really, really hard. I was sick. I was not able to hold down food and water, not able to wasn't as mobile as I needed to be, and all these things. And so it was really, really hard trying to navigate a system that wasn't set up to actually help me. There was barrier after barrier after barrier. You have to wait for 60 days for your Medicaid application to process. Well, daggone, I might be like 8 months pregnant by then. Like you can't get rental assistance because you don't have a job. You can't get a job because you don't have childcare. You can't get childcare because you don't have a job. It's like all these like catch-22. So anyway, serendipitously, I mean, I've just always been volunteering on boards, on commissions and community meetings. And the founders of Equity Before Birth decided when they had a baby during the pandemic, they had good jobs and each other and family and resources, but it was still hard for them to get all the resources they needed to get appropriate childcare and take care of their baby. And so they started digging and started really uncovering a lot of the disparities. And they were like, wow, it's hard for us. How is it for other people that are also dealing with like financial trouble, systemic bias, all these things? And they said, what we can do is leverage our resources and our privilege to start a charity organization so we can get financial resources back out to people. And they started plugging into all these community meetings, and they started seeing me at all these community meetings that they were plugged into around families and children, and just advocating for parent voice and Black women's voice to be there. And literally one day I got a call that said, you know what, like, you are the type of woman that we need to lead this organization. I can't lead this organization as a white woman. We need Black women to lead it. We know that. We just didn't know who. And just hearing you navigate through these spaces, we realized it was you. And so the way I got hired on as ED of Equity Before Birth is completely serendipitous. And if I may add, I was working for county government at the time when the pandemic hit. Daycares closed, and I was an essential worker, and that didn't. And I have a 2-year-old in a pandemic, and I'm like, what am I going to do? I don't have a center. I wrote my letter of resignation. I said, I don't know what I'm going to do, but one thing I can't do is leave my kid at home by herself, right? And so it was really miraculous, y'all. Like, I have this draft of a resignation letter and no backup plan. How am I going to pay my bills? How am I going to keep my car? And then I get like this job offer that is, wow, can we pay you to do the things that you would do anyway all day, every day for free? And so
wow,
here I am.
That is awesome. That's such a great story. I didn't ask you that story when we first met because we were kind of getting down to the business at hand. But that's amazing, Joy. And obviously meant to be. That's great. Thank you for sharing that.
Yeah, I love that. I love that when you kept showing up to tables and people said, "Oh, you are already doing this work. Like this shouldn't be us. It should be you." I love that realization, and I wish that was more often the case, right? Where we actually recognize, hey, who's best equipped to do this? The people that have lived it, have breathed it, who are most proximate to these systems and run these barriers themselves. That can have this empathy to be able to walk alongside others, and then, and now you are empowered in this role. And so, Joy, I'd love to follow up with you. We've been talked about this in this season. One of the themes that have kind of permeated a lot of our conversations here in season 3 is around fusion friendships. Not a term we made up. We found online through a local person that wrote an article. But this idea of finding relationships in our lives that cross lines of difference, but finding some common ground where there's actually, you can link arms with someone that maybe is not like you in whatever way, to be able to pursue a shared vision. So can you tell us just a little bit, this can be related to the Equity Before Birth story or not, but just a fusion friendship that has been particularly impactful for you personally?
Yeah, I would say all of the relationships that are forming as a result of this work, especially with the founders of the organization. I don't think that we may have typically found each other and been friends. We're in different education brackets, economic brackets, from different backgrounds and experiences. But what I have noticed is that a lot of people can bond over this topic. Everyone has a mom, regardless of your relationship with her. And if you are a mom, it's this unspoken, like pregnancy is hard, right? But like you don't speak about it out loud in public, but sometimes when you get in private and you have these conversations, it's like, oh my goodness, me too, or I experienced that too, or oh my goodness, we survived and navigated this too. And so my number one fusion friendship would be with the founders of this organization, just realizing we have kids similar age and navigating similar challenges and feeling similarly about hot topic items and enraged about the same things, impassioned about the same things. And I don't think without this topic being brought to the forefront that I would have found some of those connections. And even with some of our partnerships being really atypical, there's so many organizations and businesses and B Corps and things who are interested in helping to eliminate disparities and address this issue and saying, hey, I remember my sister going through this. I remember my mom going through this. My grandmother lost her child and we never talk about it. And it's really brought people together on a common ground where I don't think we would have had these conversations or even made these connections before.
I love that. The great equalizer. Everybody has a mom.
Yeah. Regardless of your relationship with her, we all know. Right?
Right. We all have that in common. At least that one thing.
Yeah. Exactly right. All right. Well, I mentioned earlier that you testified before Congress. And so I just want to kind of shift a little bit around policy. So we know there's some changes, right, nationally around childcare support. I'm wondering, when you think about that social safety net locally, where are you seeing the impact? Where are the gaps? How is it showing up? Maybe just give our audience a little glimpse into the policy setting and how you're seeing it play out every day. Here, obviously we're here in Durham, but for our listeners who are all over the place, how they can maybe think about how it should be showing up locally for them as well.
Yeah, I love this question. It's a huge question. I would encourage folks to just really start thinking more critically about policy and how it affects our day-to-day. So we have some unprecedented policy proposals on the table right now at the national, state, and local level. So the Biden administration is doing some really important things to try to increase our paid leave opportunities, increase our access to health care, invest more money into childcare infrastructure. And those conversations are trickling down where we're seeing on the state level kind of like some companion bills. So there may be federal proposals for childcare and paid leave, but there are also now state proposals for childcare, paid leave, extending Medicaid through more than 6 weeks after you have a baby, extending it to the first year. And so I will say that what I am most excited about is that our local elected officials like Senator Murdoch and Representative Zach Hawkins and others, especially in Durham and surrounding areas, have tapped into us, have asked Black moms, have asked local nonprofit leaders, say, what types of legislation would really, really be helpful? And so we have legislation now that addresses the need for implicit bias training with healthcare providers. And we have legislation on the floor that addresses the need for expanding Medicaid, covering doula services with health insurance. We have legislation that calls even for funding towards organizations like us, Equity Before Birth, and our partner organization, MAME, that can help us sustain our work. I will say that these pieces of legislation are unprecedented and important because you have folks with lived experience that help to draft these pieces of legislation. I even read them like, whoa, they kept that in there? Like, we're really going to try to do this and do the thing? So it's really important for us to tap in and to let our elected officials know that these are the types of legislation we need to see. We need to see money trickling down to grassroots organizations and into actual households. We need to see more childcare subsidies so that people can afford the quality childcare centers. We need to see more paid sick leave benefits and maternity leave benefits. We have so many people bringing sick kids to daycare and going to work sick because they literally cannot afford. In fact, 62% of working Black adults cannot afford to take a day off because they don't have an opportunity to take it off with pay.
Wow.
And that's a lot. Can you imagine how many folks are not taking care of themselves just because they simply cannot calculate their ability to rest?
Right.
Yeah. We need to call the NAP ministry to come in and join us on this advocacy, because a lot of it is about just us not being able to rest and recharge and take care of ourselves. And so to answer your question, there are a lot of good policy movements going on that, if passed, will trickle down and we will feel directly. We will see money coming in for childcare. We will see money coming in for paid leave. We will see money coming in. To answer one of your early questions, I think there's just such a huge investment that has to be made to see a ROI in community. A lot of people want that immediate gratification, and that's not what we're dealing with. We're investing in community in a way that's going to affect us for generations to come. So if I'm pregnant and you invest in me to be able to take care of my baby, not only am I going to return to work for the long term, my baby's going to grow up healthy and able to enter and be a productive member of the workforce. And then as them being a healthy member of society, their babies are going to come into the world healthy and be able to enter and be a productive member of the workforce. So I think people are hesitant to invest because it's not immediately. What we're doing is we're investing intergenerationally. And so we need people to tap in, get informed, get involved, reach out, speak up, say, hey, I need paid leave. Hey, I need help with quality childcare, and we are more than happy to help folks tap in those ways.
Well, that is a lot to be encouraged by. Like you talk about, Joy, I think you're hitting on several layers here, but the pandemic, we talked about this in previous episodes of it kind of revealing so many fault lines that exist that are just really untenable for so many people in our society. And I think that moms specifically have been named as this group of like, man, this is the toll that we've asked moms to carry so much of the bulk of this load through this pandemic. We've got to figure out a new way. We got to figure out a new story that works for everybody, especially the moms that can't really go, can't rest, like you're saying, can't take a breath. That's not sustainable, and we got to do better. We got to do better by our moms, whoever they are. Period. All moms. We got to do better by all moms, and I think that's exactly what you're trying to do. If I can ask you to look forward for a bit, obviously there's some stuff to be encouraged by in the present, not as much so in the past. But looking forward, what gives you hope and almost like paint a vision for the future for our audience? What is the vision that you're working towards with Equity Before Birth? What does our community look like? And I don't know how far this vision goes out for you, 5 years, 10 years, 200 years. What is that picture? Paint that picture for our listeners of what the community looks like that you're building towards.
I love this question. It's so huge because, like you said, there's so many layers to our work. So I have a multi-layered vision. I mean, one is to kind of destigmatize and de-traumatize policies. We have a lot of harmful policies. Let's be for real. But I want us to walk into our power and understand what that means to get these changed, and to we are inheriting the system. We are our 30-somethings, our 40-somethings are the new leaders of this system. So it's going to be up to us to set those policies and set these changes. I want policy and elections not to be this arbitrary pie in the sky, oh, we vote for the president thing. I want us to realize how the budget hearing that the county just entered, a couple of weeks ago is going to directly affect the money we get in our pocket to pay our bills and to pay our rent and the jobs that we have. Like, I want us to really start to grasp that. So that's for one, is making letting folks see the power in their voice. When we speak up, we can see changes that trickle down and affect our personal bottom lines. For two, I see a vision of creating this really comprehensive perinatal health ecosystem. So I don't have to go over here to get help with food, go over here to get help with childcare, go over here to get help with housing, go over here to get my appointment for me, go over there to get my appointment for my child, and then go get my ears checked over here, my eyes checked over here, my teeth checked over there, right? I want us to streamline some of those services. And we're starting to see some of that, where we see organizations reach out to us and say, hey, such and such would really need a doula. Is this something y'all could help with? And we're saying, hey, we have them on our list and we are going to help them out and sponsor them with a doula. Do y'all have a doula for her? And so we're like starting to see that come together, where we're working with families and, oh yeah, we have her doula covered. Can y'all get her some extra diapers? Oh, can we, tap in and let's make sure Communities in Partnership knows that she needs an extra produce box this week and things so we're starting to see some of that come together, but I really want us to have break the silos, work together to wrap families around all of the support that they need. Instead of us operating like the 2,000 individual orgs we can start to have some more collaborations going. I see, of course, empowered community members where folks are having this all time, they know what questions to ask their doctor. They have their whole entire care team with them. They have their partner and their doula and their best friend who just had a baby last year, with them as a part of their care team. And I see those birth and health outcomes improving because we have these empowered family units with doctors who are listening, with providers who are there and listening. I see us expanding statewide, but in a community-rooted way. We're not going to go to Forsyth County and say, this is what y'all need to do. No, we're going to find doulas in Forsyth County and say, hey, do you see any families who have trouble paying for doulas? Do y'all have enough lactation consultants here? Do y'all have enough therapy? We're going to see what communities need and offer our help based on what communities need, and really pilot this community-rooted model where we are finding out who is already doing the work and how can we amplify and sustain that work. And so as we expand into more counties, and our vision is to expand statewide, and then we will have a comprehensive model to pilot off into other states, so that states can help families in a community-rooted way. That is what I'm committed to, and committed to keeping families involved, having them tell their own story. We ask families, how do you want us to celebrate you? We do Family Friday posts, but it's what can we celebrate about your family this week? And so really prove to folks that we can cut the bureaucracy and still have an effective and impactful organization that centers that lived experience and centers those who are most intimately connected to the issue. And so I see us eventually being nationally recognized, and other states may not be prioritizing paid leave because they may have a state paid leave program. Maybe they have to prioritize access to lactation consultants or doulas, but we want to be able to document our process enough for other communities and states to meet the needs that their community has. I know that's a lot, but it's a lot. I told y'all it's a lot.
We're doing all that, Rob.
Yeah, are you going to be quizzing me later, Jess? I feel like you keep asking me. I'm soaking it all in.
Taking a breath on my end to digest it all. Just so many things. First of all, Joy, you have vision, okay? You just painted an entire landscape of change. And none of it felt unaccomplishable to me. None of it felt like pie in the sky, I think you used that term. But to me, it felt accomplishable. It's going to require strategy.
And necessary,
accomplishable. Obviously, you're going to need partners to get this done and buy-in and all the things, but it's great vision that you are casting for your organization. I love how you're setting it up to be a national model. I'm kind of in that space where I love things. If you're going to build it, go big or go home. Build something that's going to have disruptive energy around it, where it changes the world, right? Not just your little corner of it. So I love that. I love where your head is on this. You are the right leader for this time, friend. This is so good. Now we're kind of at the end of our time with you, but I think I'm energized. What you just laid out really just gives me a lot of hope. And then that was the question that Rob asked: is what gives you hope? Your answer gave me hope. Talk to me about just one thing, and it can be more than one, honestly. But this is our series, right? At the end of our podcast, we like to wrap things up with how our listeners show up. So if you can share with us just one thing, plus or whatever. And I know there's a couple pluses because I already know you have a few things down the way that people can get involved. But how do people get involved with you? How can they show up? How can they support you? And be real specific, because I think you have some events. There's ways people can do this now in the next couple of weeks. So go ahead. I know you got a list.
Yeah. So but just one thing it is hard to say just one thing, but I was thinking on it, and just one thing, if I could say just one thing, I would say encourage everyone to educate themselves, because when you know better, you do better, right? And I think the more that people uncover how preventable this maternal health crisis is, the more people will be compelled to support. And so, just educate yourself. Visit our website, Google maternal health, Google Black maternal health, figure out, where the issues lie and how you can help. Please keep in touch with Equity Before Birth, equitybeforebirth.com, and at Equity Before Birth on all social media. We are super committed to keeping donors engaged and informed, keeping our families engaged and informed, and just the community at large, creating opportunities for us to collaborate and to empower one another. We just received our first grant awards like a couple weeks ago. We were before then 100% funded by donations, and so every single dollar helps and counts. And so donating to us, spreading the word, sharing our social media posts, sharing it with your employer, your colleague. Every time we spread the word, we find another person who's intimately connected to our issue, and it adds on to our board and our volunteers and our operations staff in the way that we're able to spread capacity. So tune in for updates. We have on July 31st, we'll be having a drive-through community baby shower, partnering with Mame and Sister Song for that. What that means is that moms in Durham will come through and pick up brand new baby items, diapers and wipes and onesies and hats and socks and baby bathtubs and things of that nature. It's actually there at Reese City in the parking lot, July 31st from 9 a.m. to 11:30 a.m. Stalk our website and social media for more details. You can donate money, or you can donate. You have a wish list. You can donate new baby items. For that, if and we do those about quarterly, so we can keep it going. If this is we're not able to make our summer one, we'll be doing something else for families around the holidays and so on and so forth. We'll be celebrating Black Breastfeeding Week in August. August 28th, we'll likely do another community outreach event, so stay tuned for that. But yes, educate yourself, plug in, figure out who in the community is doing what it is that you would like to see done, and then see if you can donate or volunteer for those efforts, because we can save our lives, and we will do that.
Joy. Yeah, thank you so much for taking the time to be with us today. Thank you for the work that you're doing. It's so important in the way that you're coming alongside families and really saving lives. Really, I mean, what you're doing is life-changing and life-saving work. And I hope that our listeners get inspired. I mean, as I listen to you, I'm inspired to say I want to get involved. I want to get involved with what you're doing, and you've made it so easy for people to plug in. So thanks for pointing the way, inviting us into this story and this vision that you laid out so beautifully today. And we appreciate you. Go enjoy a Freezy Pop when this is all over.
Popsicle.
Hey, we're gonna settle this. We're gonna take it to social media. We're gonna settle this once and for all.
Please.
Yeah.
But thank you so much for this opportunity. Also, joy@equitybeforebirth.com. Like, email me, find me on social media, find the organization, tap in. I can help. If you see a partner org that you're interested in working with, we can connect you with any of our partner orgs as well.
Thank you, Joy.
Love it. Thank you, Joy.
Friend.
Thank y'all. Y'all have a great day.